All right, hi, my name is Akhilesh, and today I'll be presenting about the unequal access to healthcare among people from racial and ethnic minority groups. So, who am I? I'm a 16-year-old. I go to high school at Hillsborough High School in Hillsborough, New Jersey. And my mentor was Oyosola, and she helped me a lot with this project and gave me a lot of tips while I was developing it. And at the moment, I want to major in psychology. So for overview, the topic will be, as I discuss, unequal access to healthcare among people from racial and ethnic minority groups. And my target audience mainly regards members in the AIAN or American Indians and Alaska Natives groups, Asian people, African American people, Mexican people, and the government, society, and hospital systems. So for why I chose this project, in the USA, hospital bills and expenses have been on the rise recently, and many people in ethnic or racial minority groups have been prejudiced by the system due to many different factors. Whether it is socioeconomic status or their race, people from these groups have not been given the same treatment as others, and everyone deserves the right to receive medical treatment since we are all members of the same nation. This idea mainly came to me during the COVID-19 pandemic, since this is the main time where medical access was very at an all-time low because of how the pandemic was taking over the country and was using up a lot of resources and that resources that the government did not have at the time. So this is one figure, and this shows how that this is like one of the main problems in the US, and it shows how people of these racial minority groups have higher risk of serious illnesses during the time of coronavirus than white adults at that time. And it shows how the rates are very high for those in American Indian and Alaska Native groups, and they're followed by members of the Black group and Native Hawaiian and other Pacific Islanders. And these rates are very high compared to those of total non-elderly adults, which include those who are white, and they have more access to healthcare than people in these minority groups. This is another figure that I thought was very important too, because it shows the ratio between patient care per 10,000 resident population. And it shows how, for the majority of the US, it's a very low ratio, ranging from 18.98 to 25.63, meaning that there's around 19 to 24, 25 physicians ready for 10,000 people, which is a very low statistic, and it shows how bad like the situation is in the USA. So for causes of this problem, one big cause I believe is hospital bills. Hospital bills have been on the rise in the USA, and they're very popular for a bad reason since they're very high. Many other nations have implemented a free healthcare system, which has greatly benefited their society, and it also increases their life expectancy. Implementing a free healthcare system in the USA at this point in time is not really that feasible because it would just make it would make our nation go into further debt. So I don't believe that this would be the best way to solve this problem, but I just still believe that hospital bills are a main cause of the reason that the unequal healthcare is so apparent in our society. Another big cause is socioeconomic status. Being able to pay the bills is a very important since having sufficient funds leads to being able to be treated. And many don't have insurance, and without insurance, the bills can be very, very high. And it's a large factor of whether people are getting treated or not getting treated. And another major cause is opportunity. As I said before, during the COVID-19 pandemic, resources were like at a very low point during in the USA. And because of this reason, some people are denied healthcare, especially in areas of low income. There are less hospitals and clinics that offer treatment or vaccinations for several diseases. And treatment refusal, denial, and other things can really lead to worsened health conditions. Treatment refusal or denial, this is because of hospital bills, since people realize that from getting treated, they'll be attacked with many hospital bills that might put them in debt. These are a few graphs I found while I was researching the topic a lot, and it shows how compared to other countries that the US has a very high percentage of below average income people in the country. And this problem will lead to people not being treated since having the funds to being treated is a major necessity to be given the vaccinations and treatments you need to be healthy. And another chart I found is how a large long-term unemployment rises as crisis drags on. This is big since this started in 2020 and is kind of going through 2024, and we don't know when it will exactly end. Unemployment has been on the rise because of COVID-19 too, since a lot of people were laid off due to people not being able to come in for work and companies not having the funds to keep all their employees. And we are currently in a recession, which leads to it being even worse on the unemployment growth. And this is another graph showing how 2 in 5 Black Americans personally experienced discrimination in a healthcare encounter. I believe this is very important because people shouldn't be denied treatment since everyone deserves treatment and no one should be refused to have a better life quality. And it shows the percent who have often or sometimes personally experienced discrimination or prejudice in their healthcare encounters based on their race and ethnicity, and is very high for Black people. So for effects of the unequal healthcare, a big effect is lower life expectancy. People in these groups have lower life expectancies, and this is shown, and I'll show like a graph later on. And data has proven that since they get treated less, they're at a higher risk for more diseases and terminal illnesses than people who are white or Caucasian. And the lower life expectancy has been on a major decline, and it's much, much lower than those who are white or Caucasian. Another big effect is worsened health conditions. The terrible hospital bills that bankrupt people scare away patients. People with illnesses hear stories of people being worse off after hospital bills because of lack of insurance, so they live with their diseases and worsen their conditions. I have seen and heard many stories and instances where one person thought about going to a hospital since they were feeling a lot of pain, but people told them and advised them not to go because they would be given a lot of hospital bills and it would not be worth it if what they had was simply something that would pass away as time went on. Another big effect would be a decreasing population. All these factors would eventually lead to the inevitable decrease of the population, and these minority groups might be small now, but many expect these groups to dramatically rise in the population and eventually take up most of the population. We are currently growing as a country, but nowhere, not at the moment, but in a few or many years, the decrease in population could be a little more apparent compared to the growth we are at right now in time. So this shows a little graph of how Native Americans still face significant life expectancy gap. Native Americans have been, and Hispanic and Black people, they have lower rates compared to white or non-Hispanic people. And this graph might be, it's from 2021, but it still shows that like their life expectancy is very low and it's several years, around like 12 in this chart, lower than those who are white or non-Hispanic, which is a long period of time since I'm currently 16, so 12 years would be a majority of my life. It would be close to how long I've lived at this point in time. And so for how does medical debt start? A majority of medical debt is start by doctor visits. Doctor visits are very important because a lot of us have experienced this too. If we feel pain or feel something coming like a sickness or illness, people would want to go to a doctor to make sure it's not anything serious or something that can be treated and be put away because everyone wants to live a long and comfortable life. But a majority of people stay away from these doctor visits or tests because of how much they cost. Doctor visits may sound cheap, but they are very expensive and could sometimes rack up if they're constant, and this is because of how much they cost. And as shown in the graph, there are a lot of other reasons, such as diagnostic tests, lab fees for like blood tests and things like that. Emergency room visits are very expensive, especially if it's something that's really a big disease or something that needs treatment immediately, like a broken bone or an illness that's been persistent for a long time. Another big thing is prescription drug costs. This I'll talk about later too, and how to fix the problem in unequal healthcare because prescription drugs have been like getting more expensive since they've been harder to get and the resources have been at an all-time low. And outpatient services are also another big part of this. So I would like to talk about this one quote I found when I was looking at stories. And this doctor said that when a patient says, I can't afford that, what is a physician to do? Physicians sign an oath that says they will help any person that comes to them and won't refuse them the treatment. So if a patient says they can't afford that and you know that they have a illness or something that needs treatment immediately, what should a physician do if they can't treat them? Should they just let them die or live a worsened quality of life? Or should they just treat them and somehow find another method of payment? But if they can't find another method of payment, the patient would go into debt. In both outcomes, the result for the patient isn't exactly desirable. So I would like to propose a few more solutions on how to fix this. So for how to fix the problem, I found and believe these are the three best ways to fix the problem of unequal healthcare. One big way to fix the problem is value-based pricing and payments. And this basically refers to how implementing a value-based pricing system for drugs and devices. So over a defined multi-year period based on like outcomes, quality, and affordability relative to existing products, this would help to limit excessive price increases. And this is mainly like a long-term plan that would make sure the prices don't go on a rise, but rather remain steady and somehow cause them to go on a decay in the later future. A big part of this is using pharmacy benefit managers more widely in government programs such as Medicaid to lower drug costs on behalf of customers. PBMs or pharmacy benefit managers have saved seniors and the federal government 24 billion in Medicare in 2015, and it shows that that's a lot a big result for using pharmacy benefit managers. Another way is to prioritize FDA reviews of branded and generic drugs when fewer than three drugs are available for a particular condition or to accelerate the availability of more drugs to stimulate price competition. Prioritizing FDA reviews of branded and generic drugs is very important. Another way to fix the problem is to enable and incentivize consumer-directed healthcare. And this means requiring payers, manufacturers, and providers to share data with customers on the quality and price of healthcare products and services to help individuals make well-informed choices. And this can help to accelerate the development of robust price and quality transparency tools by ensuring the U.S. Department of Health and Human Services classifies these tools as quality improvements, not administrative costs, to drive responsible use of the system by consumers. And the third and final way I found to fix the problem is to enhance healthcare system productivity and eliminate harmful taxes. So this would mainly be a big way to fix the problem if the health insurance tax were repealed and other affordable care taxes. And these are currently being priced into policies carrying into 2018 and will increase 27% from the 2016 levels in the near future. And this would help to drive the taxes to go down, and eliminating them would cut a major cost of buying drugs and prescription drugs and making them being able to sell for lower prices in markets. So this is like these are a few pictures I found and a few that I took when I was going around in New Jersey, and I found these pictures of free clinics and people being helped by doctors who spend their free time giving free tests, free treatment for anyone who offers it, for anyone who needs it. And I believe free clinics are a great way to be given healthcare and tests, diagnosis, and treatment to people who can't find hospitals that are affordable. So having free clinics would be helpful since if you have something serious, you'll be able to know without having to pay a major fee. So I'd like to come back to the statement I read before, and it says, when a patient says, I can't afford that, what is a physician to do? I believe the three ways to fix the problem that I said before are a major way to make sure that this question never comes up for a doctor ever again. And that's it. Thank you.
Awesome job, Akhilesh. Wow. I am curious, what was the hardest part of your research project?
The hardest part of my research project was mainly finding like stories. I wanted to find like personal stories from people who have like experienced it, since this is like a very common problem in society at this time. And I didn't want to find it like over the internet. I kind of asked around like my parents, my family. I wanted to see like how they experienced it because I know that like they have also experienced like the repercussions of hospital bills during their life. So I like asked them about their personal experiences and how it's affected other people they knew. And finding these stories like really helped like make me pursue this topic even more and help me research too.
Yeah, absolutely. That quote, that physician quote is just so wonderful and so insightful. So thank you so much for your presentation. Wonderful job.